about acute pericarditis, which is inflammation of the membrane surrounding the heart, and that's called pericardium. Chronic inflammation of the pericardium will lead to fibrosis, thickening, calcification, and that's called constrictive pericarditis. That will result into impaired diastolic filling, means the heart inability to relax or fill, and fixed total cardiac volume. So what are the causes of constrictive pericarditis? In most developed countries, most common cause is idiopathic or viral. There is not really a specific virus. For example, Coxiella virus, AMB, adenovirus, cytomegalovirus, Epstein-Barr virus, influenza virus, and now commonly COVID has been associated with a lot of cases of transient constrictive pericarditis. Other common causes: post-cardiac surgery, chest radiation, autoimmune disease like SLE or rheumatoid arthritis, tuberculosis, bacterial pericarditis, which is rare but severe, and post-traumatic syndrome. So what are the common signs and symptoms? Would be signs and symptoms of diastolic failure, so peripheral edema, ascites, and generalized edema all over, fatigue, exertional dyspnea, which is shortness of breath with activity or movement, elevated GBP, cosmal sign, which is paradoxical rise, or failure to fall in GBP during inspiration, and pericardial knock, which is early diastolic sound due to the impaired diastolic function. And these are commonly asked in exams. These signs are commonly asked in exams with constrictive pericarditis. So how do you diagnose constrictive pericarditis? Well, X-ray or CT will show the pericardial calcification, and you can see here a posterior anterior X-ray showing the calcification here in the pericardium, and in the lateral X-ray as well. CT and cardiac MRI will show also pericardial thickness more than 3 to 4 millimeter, and the cardiac MRI is specifically useful in identifying active pericardial inflammation or acute pericardial inflammation, and the abnormal septal bouncing will detect it and can differentiate between transient inflammation or chronic fibrotic changes. So regarding the echocardiogram, will demonstrate functionality rather than the structure of the heart. A very important key is they have normal systolic function or near normal. It means the pumping of the heart is normal, but the relaxing or the filling of the heart is abnormal, and it will have septal bouncing, which is the abnormal septal movement, respiratory variation in mitral and tricuspid, annulus reversus, which is abnormality with the velocity, and dilated inferior vena cava with reduced respiratory collapse. And cardiac catheterization, which obviously is not done routinely and done in specific cases when non-invasive routines are unable to diagnose or the patient is booked for surgery. It will show equalization of the diastolic pressure, the deep and plateau sign or squared root sign, and ventricular independence was discordant with the left and right ventricle systolic pressure during respiration. And the management in subacute or transient constrictive pericarditis, a trial of medical therapy is attempted, which is similar to acute pericarditis, and that's best suited for active inflammation and acute inflammation. But if failed, or in chronic constrictive pericarditis, the definitive treatment is to remove the pericardium.